Good afternoon, everyone. We still have people joining us. Um, I'm Steve Higgins. I'm the director of the Vermont Center on Behavior and Health, and I want to thank you for joining us for the November um, version of or November issue, if you will, of the monthly lecture series. And I'm going to get us going with a little bit of housekeeping. We're in for a wonderful lecture today. We have Joe McClernon coming speaking to us, and he's a terrific investigator and excellent public speaker. So that'll be a treat. But before we turn to Joe, I want to just mention that, as you see in a slide here, we have two postdoctoral fellowships open with us through our NIDA T32 training award. And this is a postdoctoral fellowship where you would work with Sarah Heil and Kelly Peck, and then a second one where you would work with Stacy Sigmund. So you see the contact information for Sarah and Stacy at the bottom right of the screen. And so please reach out if you know of anyone who might be looking for a postdoctoral fellowship in the behavioral pharmacology of drug use disorders. Please pass this information along. So I think I wanted to mention one other thing that we have a final lecture for the fall semester, and that's on December 18th, where Hugh Garavan, one of UVM's own professors, who's very active in the ABCD project that NIDA is supporting, a really amazing project on the longitudinal effects of drug use on neurobehavioral development. So that's on December 18th, Hugh Garavan. So please join us for that. And now I think I will turn over the podium, so to speak, over to Eli Klemper, who's the Associate Director of the Vermont Center on Behavior and Health. Eli?
Thanks, Steve, and thanks everybody for joining today. Joe, you can go ahead and share your slides now, and I'll introduce you here. So it's my pleasure to introduce Dr. Joe McClernon, who's a leading expert in the field of addiction science and tobacco regulatory research. Dr. McClernon is a professor in the Department of Psychiatry and Behavioral Sciences at Duke University, where he also serves as the founder and director of the Center for Addiction Science and Technology, and is associate director of the Duke Clinical and Translational Science Institute. Dr. McClernon earned his PhD in clinical psychology from Southern Illinois University, Carbondale in 2001, and completed a postdoctoral fellowship at Duke before joining faculty. Over his career, Dr. McClernon has made significant contributions to our understanding of tobacco dependence. For over a decade, he has played a pivotal role in the Center for Evaluation of Nicotine in Cigarettes, otherwise known as CNIC, which has informed the FDA's proposed groundbreaking policies to reduce nicotine levels in cigarettes to non-addictive levels. Now, Dr. McClernon is spearheading efforts to ensure these policies are implemented equitably with a focus on marginalized populations. And his research really spans a wide range. It was really a pleasure looking over his CV before this, just to look at all the different areas his work has touched. Personally, Dr. McClernon's framework on multiple tobacco product use shaped the way I think about dual use and really serves as a foundation for much of the work I do. So it's exciting to get to hear him talk about that topic today. In addition, Dr. McClernon is an active mentor from individuals all the way from high school through early career, and his trainees now serve as faculty, staff scientists, et cetera, in medical centers, government agencies, and research institutes. He has over 185 peer-reviewed publications and has been continuously funded by NIH, FDA, and foundations since 2002. So I'm very much looking forward to his talk today, titled "Are Cigarettes and E-Cigarettes Substitutes or Complements? And Does It Matter?" So with that, I'll turn it over to you, Joe. Thanks.
Great, thank you a lot, Eli, for that really fantastic introduction. And I'm so pleased to be with all of you here virtually today. Big thanks to Steve for the invite here, and for Chris Pung, who helped me get through all the paperwork to make today necessary. But it's really amazing. I was just looking at the list of participants, the attendees of today's talk, and seeing folks that I've known, trained with, and trained over the last 25 years. It's just really fantastic to see. And this talk is maybe a little bit different than talks that I've given in the past. I've been thinking about and writing about cigarettes and e-cigarettes for well over 6 or 7 years now, and thinking about the relationship between them and whether they're, in what context they serve as substitutes and what context complements, and have even been writing about dynamic complementarity. But this is really the first time I've had a chance to talk about this this subject to an audience. And there's nothing like having to give a talk to really sort of more formalize your thinking about something, and really push you to think deeply about it. At the same time, this is the first time I've given a talk on this, and I don't know that there's been a lot of discussion or deliberation in the field around cigarettes and e-cigarettes as dynamic complements, and I'll talk more in a little bit what I mean by that. Let's consider this an opportunity to work together on this. I'm really looking forward already to hearing questions, thoughts from all of you about the way I've been thinking about cigarettes and e-cigarettes. I was instructed to have this slide up for some period of time. I don't have anything in the way of conflicts of interest. All of my funding is from NIH, FDA, and I have no financial relationships that really matter in this context. Okay, so here's what I want to do today. I'm going to quickly, really in one slide, review the epidemiology of cigarette and e-cigarette dual use. I'm going to define substitution and complementarity and present a model of multiple tobacco product use. I'll review existing and present new data supporting substitution and complementarity effects. And then I'll discuss implications for thinking about cigarettes and e-cigarettes as substitutes and or complements to one another. Okay, so what got me really thinking about substitution and complementarity was, really 7 or 8 years ago, coming to the realization that, e-cigarettes are in the US tobacco product landscape. They're increasing in their popularity, and we started to see that a lot of tobacco users and smokers specifically were using more than one tobacco product. And so we were starting to see quite a bit of dual and multiple tobacco product use. And so here's the headline from a paper that Lauren Pasek and I worked on with Andrea Valenti there at Vermont on the epidemiology of multiple tobacco product use and some implications for treatment, research, and regulation. And what we found in an analysis of PATH data was that around 40% of all smokers were multiple tobacco product users, including very close to 50% of non-daily cigarette smokers. We also found that over 50% of individuals who reported using e-cigarettes, cigars, cigarillos, other types of tobacco products were also dual or multiple tobacco product use. So there was this idea that dual and multiple tobacco product use were becoming more prevalent. And of course, we also observed that the most common form of dual use was cigarette and e-cigarette use. And so that really got my attention, and that was sort of what sparked the interest in studying dual use. And at the time, I think the conventional wisdom was that e-cigarettes are substitutes for combusted cigarettes. Maybe not perfect substitutes, but that's the way that's the relationship between the two, and that's how they're going to operate, is as substitutes. And so you could think of combusted cigarettes as Coca-Cola Classic, and maybe you could think about then Diet Coke or RC Cola being like e-cigarettes. And so if you're a Coca-Cola Classic drinker and you're concerned about the costs associated with ingesting the calories in Coca-Cola Classic, you might switch to Diet Coke. If you're concerned about the price of Classic of Coca-Cola, you might switch to a lower priced product like RC Cola. But the idea here is that as the costs associated with with using combusted cigarettes goes up, you start to increasingly substitute that that combusted cigarette use with e-cigarette purchasing and consumption. And this is what Johnson and colleagues found in their 2017 paper, where they did a cross-price elasticity task. They showed that as the hypothetical price of tobacco cigarette puffs increased, you saw an increase in the number of puffs of e-cigarettes that were purchased. And their sort of top line finding was that e-cigarettes may serve as behavioral economic substitute for tobacco cigarettes. So I think for a while that became sort of the conventional wisdom that e-cigarettes are maybe not a perfect substitute for combusted cigarettes, but serve at least as a partial substitute. But then in looking at the literature, and particularly looking at qualitative studies of the reasons and the context in which dual users were using cigarettes and e-cigarettes, I started to think there's more to this. And this is a really great paper from Julia McCoy. She did in-depth interviews with 21 young adults who regularly use cigarettes and e-cigarettes and smokeless or smokeless tobacco. And the goal of this was to really understand the reasons for the use of each of these products and what sort of purposes these different products serve for dual users. And so, they first note this finding that different products, cigarettes and e-cigarettes, can be used as a strategy for reducing the perceived tobacco-related harm. So this feels very much like what we described as a substitution. But then they go on to say that cigarettes are uniquely capable of aiding in the space-time organization of everyday activities and coping with crisis. And what they mean by aiding in the space-time organization of everyday activities is product users saying that, well, I'll use a cigarette. It means being able to take a break, or it means I can use it to sort of bookend I'll have one on the way to work, and I'll have one at the end of work, and I'll have one at the end of the day. And it sort of, organizes time in my life in these buckets. So that's cigarettes, but that ends in smokeless tobacco operate differently, that they open up times and spaces for nicotine consumption. So the idea here is maybe I can't go out and have a cigarette. So I'll vape in my office, or I'll vape in a restroom, or in a place where smoking is not allowed. So this is sort of qualitatively different than substitution, right? This doesn't sound like, it sounds like we have, and I saw this over and over again in the qualitative work. It doesn't sound like substitution anymore. It sounds like something different. So the next sort of question is, well, then are cigarettes and e-cigarettes acting as complements? And when we think about products that serve as complements to each other, we think about products that are used together, and we think about products where the value of one increases the value of another. So the sort of classic example is peanut butter and jelly. People like to eat peanut butter jelly sandwiches. If the price of peanut butter goes up, consumption of peanut butter goes down, consumption of jelly goes down too, because people aren't making as many peanut butter and jelly sandwiches. You can think of coffee and sugar in the same way. You can think of inkjet ink and inkjet printers in the same way. Any products that whose value is correlated with one another in a positive way. So, does this ring true? And the more I thought about it, it really didn't. And in part because people don't make, and I'm being a little cheeky here, but like people don't make cigarette and e-cigarette sandwiches, right? So these products they're not consumed together at the exact same time, very typically by users. But the other reason it didn't really ring true is, again, going back to Matt's work, I didn't really see evidence that participants in their study were showing patterns of complementary use between cigarettes and e-cigarettes. And in fact, when they looked at the individual level data, less than 10% of participants were showing any kind of effect that looked like complementary use. So it seemed like they were more than substitutes, or different than substitutes, but also at the same time, maybe not exactly the sort of classic complements that we think about. And that's when, I think sometime around 2016, 2017, I thought, surely, I mean, it's sometimes easy for us to forget, or at least some of us, or maybe just me, that cigarettes and e-cigarettes are actual products, and that there's a whole field of academia and inquiry out there that is focused specifically on products and how they're marketed and advertised and how people use them together. So I started to look into the marketing literature to see if there was some understanding of how products may relate to one another that isn't strictly the way we think about substitutes or the way we typically think about complements. And that's when I came across this just really amazing paper by Shocker and colleagues from 2004. And what they do is they provide a really nice description of how products in a market can relate to one another beyond the sort of idea of sort of strict substitutes versus complements. And I love the language that they use here. So sometimes this is directly out of the paper. Sometimes the relationship between products can be both substitute and complement. Okay, so that's really interesting already. That is, two products may be complements for one purpose, but substitutes for another. So already, we're thinking this is a new way of thinking about how cigarettes and e-cigarettes may relate to one another. These individual level effects may cancel one another out so that an aggregate intercategory relationship distorts individual level realities. So maybe some idea here that when we only look at averages, we're not going to really understand the relationship between two products. And that different users may purchase products for different reasons. So individual differences here and motivations and reasons for use. Or that the same user, so even a single person, may use products differently at different times or in different contexts. It's a lot. It's a lot to unpack in just a few short sentences. But I read this and I thought, okay, these guys, this is in 2004. I mean, they don't know anything about e-cigarettes, right? These guys are starting to think about, these guys are thinking about products in a complex marketplace in a way that maybe we should start thinking about cigarettes and e-cigarettes. Okay, so and the example that they use, and these marketing people are great because this paper is, every time they give an example of some or propose a way of thinking about the relationships between various products, they give an example. And their example of this sort of dynamic complementarity is and substitution is the news marketplace, which, we don't have to do a formal poll here. I'll be surprised if any of you get all of your news from a single source. None of us do that anymore these days. And in fact, there are so many options to choose from podcasts to print media to TV, radio, etc. And what we find is we use these things as complements to one another frequently, right? We may choose a variety of news outlets because sometimes we're valuing headlines, sometimes we want a deeper analysis, sometimes we want news that fits with our worldview, sometimes we want to be challenged a little bit. But any one of these news sources can also serve as a substitute for others. So you may decide, I don't need my news from 5 or 6 different sources. I'm just going to get all of it from the New York Times, right? And your use of these different news outlets and the degree to which you use them as substitutes or complements may change over time. It's going to vary across people, and it may depend on what kind of information you want or need at any given time. So the news outlets are a very complex marketplace where you can see these more complex relationships between products that look like substitution and sometimes complementarity. And this is not unlike the marketplace that tobacco product users are faced with on a daily basis. where you see a broad range of tobacco products that, based on data that I've already shown you, and I'll show you some more, people use in different ways in different contexts. And sometimes it looks like substitution, and sometimes it looks like complementarity. And so this, all of this led us to develop a multiple tobacco product framework that, and I'll show it in just a second. We released the first iteration of this back in 2019 with Lauren and Jenny Wiley. Lauren, who was at Duke at the time, and Jenny Wiley at RTI. And then we did an update to this led by a medical student here at Duke, Dana Rubenstein, in 2021. And the real motivation here was to develop a model. I was having a hard time sort of framing, how do we think about cigarettes, e-cigarettes, all the products in the landscape, but also how do we start to think about how policy regulation can impact on the use of tobacco products, and then what are the sort of end effects of that on exposure to toxicants and carcinogens and their effects on population health. So this is what the model looks like in its most recent form. And the idea here is that tobacco products are manufactured, marketed, and sold within the context of a complex and dynamic market. So gone are the days when we could just think about cigarettes all day. We now have to think about a very complex tobacco marketplace. As noted before, a substantial proportion of tobacco users use 2 or more products currently or transition between single use of products and multiple tobacco products over time. The mix of product use over time is influenced by person level factors. We also outline that it's influenced by product level characteristics and by contextual factors and the interaction between these different levels. And a major premise of this model is that in a dynamic marketplace, any factors that influence the use of one product will have an impact on the use of other products in the market. And that these factors could be market forces, like the entrance of a new product. They could be the impact of regulatory or policy actions. And we outline some of those here. It could be taxation. It could be any number of policy interventions. These influence the availability, pricing, and appeal of products, and therefore influence the effects not only of the intended or target product, but can also have cross-product influences which are dependent on the degree to which 2 products serve as substitutes or dynamic complements. So if you regulate product A in a way that makes it less appealing, and product D is not perceived by tobacco product users to be a substitute, they're not going to move from product A to product D. If product F is perceived to be a viable substitute for product A, and you increase the costs associated with using A or remove it from the market, then users will flock to product F. So the idea there is that, again, the degree to which people are moving between the use of single versus multiple or dual products varies as a function of a lot of factors that sit outside the actual products, but also varies as a function of the degree which products are deemed to be substitutes or dynamic complements. Okay, so you notice here that's products A through, I'm noticing we left out E. I think the one that's, I'm just noticing this now, I think the one that says new product used to be product E. And in this formulation of the model, we wanted to emphasize what could happen when a new product enters the market. So, but the idea is that this model can be applied to any number of products. And, of course, this is my baby, so I love to talk about it. I'd love people to look at these papers. One thing that I'm particularly proud of is that we spent a lot of time thinking about not only reviewing the literature that speaks to this model, but setting forth a research agenda in both of these. So we're sort of giving away a lot of research agenda, and I'd love if people are looking at that and giving us feedback or taking action on the research questions that we identified. The other thing that we felt pretty good about was mapping these all of these regulatory and policy actions onto specific levels or layers of the model. So that's another feature to look at with this model. Okay, so yeah, this model is nice and all, great, but it doesn't really answer this question, like why does some research provide evidence that cigarettes and e-cigarettes are substitutes, while other research provides evidence they are complements? And so this has been kind of an interesting thing that's emerged from having the model out there, looking at the data from studies as they come in, seeing how people are talking about their results, talking about whether cigarettes and e-cigarettes are complements versus substitutes. So let me just present a little data here that speaks to cigarettes and e-cigarettes as substitutes versus complements. So I already presented the data from Johnson et al. This is some nice work from Tyler Niver there at UVM, looking at the effects of cigarette prices on purchases of non-cigarette tobacco products, including Juul. And what you can see here is that as the price per cigarette increases, there's increasing purchasing of Juul e-cigarettes. Again, showing nice evidence of substitution between cigarettes and e-cigarettes. This is real-world sales data from Chad Cotty, and he's using looking at the effects of e-cigarette and cigarette taxation on e-cigarette and cigarette sales using Nielsen scanning data. And these dashed lines show quarters to adoption of taxes on e-cigarettes. And what you can see is that, not surprisingly, when there's when you increase taxes on e-cigarettes, e-cigarette sales go down. At the same time, cigarette sales go up, again, suggesting substitutions at play. The other place where you see substitution, this is data from a paper that Lauren and I published in 2020, where we asked young adults who dual use what they would do in response to a national ban on flavors and e-liquids. And what we found was, not surprisingly, larger numbers of them said that they would reduce or quit their use of e-cigarettes. Larger numbers of them said that they would maintain or increase their use of combusted cigarettes. This is data from a recent lab study that I don't have time to go into all the details now, but we had dual users come into the lab, and they were given opportunities in 3 separate sessions to make choices between using an e-cigarette or a combusted cigarette. The combusted cigarette was always their usual brand cigarette, and the e-cigarette varied. So in this gray condition, it was their own e-cigarette that they brought into the lab with them. And another one, it was a study e-cigarette that was tobacco flavored. And then in this purple condition, it was a study e-cigarette that they got to choose which flavor they wanted. And it could be a non-tobacco flavor. And what you see, not surprisingly, is that when the only option is a tobacco flavored e-cigarette, they're making fewer choices for the e-cigarette. They make a few more choices when the e-cigarette that is available is a study e-cigarette that has a flavor of their choice. And then we looked at their choices for combusted cigarettes, and what we saw was that when the only e-cigarette available was a study e-cigarette, they increased their choices for cigarettes. So it's a little hard for us. We're still sort of unpacking what it means that there wasn't a difference, regardless of whether it was a tobacco flavored or a flavored cigarette. But the idea here is that if you somehow make their e-cigarette less appealing, in this case by making it a study e-cigarette, they're not their usual brand e-cigarette, they're going to start to make more choices for cigarettes. Again, evidence of substitution. What about complementarity? So this is a This is an EMA study from Betts et al., where they recruited dual users and did 2 weeks of EMA and asked the participants to report on the context in which they were using cigarettes and e-cigarettes. And so in yellow here are the contexts in which they were more likely to report using cigarettes. So when they're around other people who smoke, when they're having cigarette craving. And then in blue here are contexts in which they're more likely to use e-cigarettes, and they're going to use e-cigarettes more when they're around other people who vape, and when they have e-cigarette craving, that makes sense. But notice they're also using e-cigarettes more often in contexts in which cigarette smoking is not allowed or legal. So again, here, this is more evidence of complementarity. This is using cigarettes and e-cigarettes for different reasons. This is a really interesting study that I came across looking at the relationship between reporting that you're using e-cigarettes in contexts where smoking is not allowed in England. And this was a survey of over 5,000 adult dual users in England that participated in a nationally representative monthly survey between April 2011 and February 2020. And what they saw was that there was an increase from 52% to 74% of respondents endorsing that they smoke in places, they use e-cigarettes in places where smoking is not permitted over time. And then what was really interesting is that the using e-cigarettes in places where smoking is not permitted was more prevalent among younger respondents who were lower in SES, who reported stronger smoking urges and had recently failed to quit and were not attempting to cut down. So this is already telling us maybe there's some for people who are more likely to use e-cigarettes as complements, is there maybe something different about them? And does this represent a potential liability towards greater smoking and more difficulty quitting smoking? And so we actually have some confirmation of that. So these are brand new data. Lauren Pasek recently conducted this analysis where she took data from wave 6 of PATH. There are 11 items that ask about reasons for ends use. And you can see they vary everything that feel like substitution type items, like number 10, using e-cigarettes as a way of cutting down on my cigarette smoking, but then also ones that sound like complements. So using ends at times or in places where smoking cigarettes is not allowed. And she ran a latent class analysis on data from 713 established users of cigarettes and ends to derive the most likely class membership for each individual, as well as the probability of item endorsement used to measure each class or subtype. And a 3-class model was selected based on the basis of a combination of model fit, indices, parsimony, and our clinical judgment. And let me walk through these 3 groups or 3 classes that we observed. So class 3, it's easier, kind of not going to go in order here. It's a little easier to talk about if we go out of order. But class 3, she came up with this really great name. These are ends superfans. So these folks are reporting that we're endorsing pretty highly on all of the various reasons for using ends. And you can see that with the green line here. The next ones are the substitutors, and they comprise about 20%. They comprise 27% of the sample. And what you can see is that they are really strongly endorsing that ends help people quit cigarettes, that they use ends to cut down on cigarettes, and that they use ends to quit cigarettes. And then finally, class 1, which is about 33% of the sample, we're calling our complementers. So they are, like the other groups, reporting that they use them in situations where they can't smoke because they don't smell, but they are not endorsing these items around using e-cigarettes to cut down on cigarettes. So superfans, substitutors, and complementers. These are very preliminary. She's finishing up these analyses and we'll be writing them up very soon. And there's more analyses to be done. But the first look at this was to look at cigarette use characteristics by class. And only two things came out significant here: cigarettes per day, where it looks like the complementers are reporting greater numbers of cigarettes per day compared to substitutors and superfans. And they're also reporting lower interest in quitting. If we look at e-cigarette use characteristics by class, all of these were significant. So our superfans are reporting using ends more times per day, more days per month. A greater proportion of them are using an e-cigarette within 30 minutes of getting up, and a greater percentage of them are reporting daily ends use. You can see that the substitutors are also much higher than the complementers, around ends days per month, and proportion of daily ends use. So this is pretty consistent with what was seen in England, that English sample, and is also additional evidence that people who are primarily using cigarettes and e-cigarettes to substitute versus complement may represent really different classes of tobacco users. So intermediate conclusions. If we look across all these data, and there's so much more. I mean, we can just go on for hours here. Substitution-like effects appear to be more obvious when data are aggregated or reported at the jurisdiction or population level. They're more obvious when context is not allowed to vary, and when participants are forced to aggregate across times and contexts. And what I mean by that is, if you ask someone how they would respond to a policy, for instance, when they tell you what they'll do, we like to think that they're aggregating their sort of behavior across time and context. So you're sort of forcing context out of the equation when you ask. You're forcing them to aggregate across time and context when you ask them to do that. At the same time, complementary-like effects are more obvious when we're examining individual differences, when we're looking at use behavior across contexts, like in EMA studies, or when we're asking people about the reasons or purposes for their use of various products, like we see in qualitative studies, or like in the survey study from PATH that I just showed you. And it's also looking like these participants who have more complementary like use of cigarettes and e-cigarettes, or less substitution like use of cigarettes and e-cigarettes, look to be the higher risk group. They report greater cigarettes per day, lower quit interests, and more quit failures. And if we go back to Shocker, which I hadn't really done in a long time until getting ready for this talk, it's pretty striking, right? Just how well what they were saying about dynamic complements in a complex marketplace really maps onto what we see around cigarettes and e-cigarettes. And when we see things that look like substitution versus complementarity, and how we can lose some of the richness in the way these different products relate to one another when we aggregate and lose the individual level realities, and when we aggregate across time or different contexts. Okay, so this is all really cool. You know, yay for us for having developed this model, and now for you know, finding all this data that fits our perspective and worldview. You know, the next obvious question is, does any of this matter, right? Does this have any real bearing, or should it have any real bearing on how we think about intervening on tobacco use, whether it's in terms of policy or clinical intervention? And yes, of course, it does matter, because I'm giving this talk. I think it matters, or actually maybe it does. And I'm going to say maybe because I'm an academic and we always hedge, but also because I think there's a lot more that we need to know. And I don't know that we've done as much thinking as we can around how substitution and complementarity might be important to the way we think about policy and clinical intervention. So let me talk about that for just a little bit. And one of the reasons that it matters, really just coming out of the model itself, is that the degree to which products serve as substitutes or complements, and the degree to which individuals use them that way, and the degree to which product characteristics, policies, situational, person-level factors, all these things influence the mix of products that people use. Because there is a continuum of risk of tobacco products, then it's going to have an impact on use and then on downstream exposure to carcinogens and toxicants. So for that reason, yes, anything that influences the mix of products that people use and how they use them is going to matter, because it's going to have a downstream impact on the health of the individual and also population health. And this is particularly salient when it comes to cigarettes and e-cigarettes. Evidence is shown over and over that e-cigarettes result in less e-cigarette use on a, keeping all things equal with respect to nicotine exposure, result in substantially less exposure to toxicants and carcinogens. And that among dual users, the exposure to toxicants and carcinogens is really directly proportional to the amount of combusted tobacco product use. So does it matter? Yes, maybe. And let me just present some data on 3 contexts where I think it might, and we're going to zoom through these because I want to make sure there's time for questions and discussion. So the first is ENDS as a smoking cessation intervention. This recent Cochrane review, I'm sure everyone is aware of this now, reporting high certainty that e-cigarettes result in better cessation outcomes than nicotine replacement therapy. This is great, right? At the same, and lots of data to support this. This is data from Pulvers et al. This is a study where smokers were randomized to either use Juul for 6 weeks or to continue smoking. And what was observed in the Juul condition is substantial decreases in NaAl and carbon monoxide levels over the course of that 6 weeks. The other thing that happened, though, and I credit Pulvers and colleagues for reporting on this, and also reporting on biomarkers of exposure outcomes by these groups, but they report on the switching patterns that were observed. And it's pretty striking that at week 6, 58% of participants in the Juul group were dual users. I think what's even more striking is that this group of smokers, more than 4 months after they were not being supplied with Juul e-cigarettes anymore, are still dual users. Now, that dual use was associated with lower levels of toxicant exposure than was the smoking group. So that's an overall net good, but we created a lot of dual users along the way. This is also evident in Matt Carpenter's recent sampling study where they mailed e-cigarettes, a 4-week supply of e-cigarettes to smokers around the country. And at the end of 4 weeks, 74% of the sample were dual users. 73% of those were still dual users at week 12, and another 75% of those were still dual users at week 24. Now again, he presents evidence that these dual users are smoking less cigarettes or having lower levels of, or smoking fewer cigarettes per day, I believe it was, than the group that continued to only smoke. But again, we've made more dual users. And so this results in, I have some questions about this. So I think the first question is, who are the people who become dual users when ENDS are used as a smoking cessation intervention? And are these complementers who have discovered a new tool that perpetuates their use of cigarettes and delays cessation? Or are they substitutors who are continuing to use ENDS to help them cut down and eventually will quit smoking? I think this is a really significant public health question that we need to address and very soon. And we need continued long-term follow-up and studies these switching studies and e-cigarette cessation, smoking cessation studies using e-cigarettes, and also measures, and also importantly, measures to assess reasons for dual use towards, you know, when we do see dual use, we need to include measures to understand where it's coming from. Are we creating dual users who are using them as complements, or those who are using them as substitutes? And all of this is very important in the context of this recent commentary where, you know, we're now Brian King, Ben Toll, Tracy Smith are advocating that providers talk to their patients who smoke about the continuum of risk, and advocating where possible that they transition to make a complete transition to exclusive e-cigarette use. And that's the really important piece here. But I think providers might need to be aware too of the fact that that dual use may arise, and that depending on the nature of that dual use, further intervention may be needed, and we're not just giving smokers tools for continued combusted tobacco use as a complement to their smoking. The other places in smoking cessation for dual users, we're still waiting for more data to come in around these interventions. A lot of great work coming from Tom Brandon's group, developing scalable interventions to improve outcomes for dual users. And again here, you know, I was not able to find, but I think it would be interesting to explore the degree to which we see differential outcomes, cessation outcomes among dual users who are primarily using these products as substitutes versus using them as complements, and asking the question, do we potentially need different strategies for supporting smoking cessation among these different types of dual users? And then finally, I'm going to skip over this real quick. We do need, this is data from the most recent scenic trial, where we randomized people who smoke to either normal nicotine or very low nicotine content cigarettes. And we could spend an entire hour just talking about this figure. But basically, this is the normal nicotine content group. I'm showing individual subjects' trajectories of tobacco product use over days from randomization. And what you can see is that just being put in a marketplace where you have the opportunity to purchase alternative nicotine delivery systems, these were all non-combustible, you start to create a lot of dual users. So you put these in front of people who smoke, they start buying them, they start using them, you start to make some dual users. Who are these dual users? It's a really good question. I don't know that we have the data in CNIC to be able to say whether they're using them more as complements or substitutes. But in our VLNC condition, so this is the group that was randomized to smoke very low nicotine content cigarettes. Again, we're making a lot of dual users. A lot more of the participants are abandoning their combusted cigarettes. More of them are becoming dual users. What's really interesting here is that dual use looks like a pathway towards using non-combustible products only. And so this is really interesting. This is, and in fact, it looks like the predominant path to using non-combustible hands only is really through a period of dual use. And I think it'd be really interesting to understand motivations, reasons for use of products, both as dual users and then as they transition, and try to understand what taking the nicotine out of combusted cigarettes, how it's influencing those motivations and reasons for use and those transitions. And then I also just want to note, we need to know a lot more about how single product standards and regulations like nicotine reduction in combusted cigarettes influences the tobacco product use behaviors of people who dual use or use multiple tobacco products, given its prevalence. And thus far, most of our research is on single product effects. But again, recognizing that these products exist in a complex marketplace makes it really important to look at the impact of potential of policies on dual and multiple tobacco product users. And that's exactly something that Eli is going to be doing there at Vermont, looking at the effects of nicotine reduction in cigarettes on tobacco product use among dual users. Okay, so I'm just going to stop there pretty much. I'm calling for a more nuanced view of e-cigarettes as potential substitutes for and complements to combusted cigarettes. I want us to recognize that the balance of substitution and complementarity is varied across people and dynamic within individuals. We need continued research to understand the implications of this and use our nuanced understanding to better and more effectively intervene. And I want to really quickly thank Lauren Pasek and Dana Rubenstein, who have been my primary thought partners in thinking about dual and multiple tobacco product use. Lauren was a postdoc and then early career faculty colleague at Duke, then was at FDA. I think her last day at FDA was some day earlier this week, and I'm excited that she's going to be starting at Rutgers very soon. Dana Rubenstein is a fourth-year medical student who also worked with Jazz Alawali at Brown. Dana started working with me as a first year. I think she might actually be in the next office over doing residency interviews. So we don't know where she's going to end up next, but she is definitely a rising star. I'm going to go ahead and stop there, and I look forward to your thoughts and questions.
Great, Joe. Thanks for a really stimulating lecture. So we have some comments and questions already available. So Sarah Pratt, more a comment, but you can respond to it.
Mhm.
Well, yeah. She has two questions, comments. First one is, pointing out how use is defined is an important factor, and pointing out that's typically made regarding the frequency of e-cigarette use in the past 30 days, but she thinks it's more important. It's really important to be focusing on more frequent use, and then points out later, a few minutes later, that cost is obviously an important factor to consider regarding multiple product use. So, and especially in people with serious mental illness. So maybe you can just respond. I think she's kind of underscoring for you the point that you're making, which is that this will depend on a lot of different factors.
Yeah, I really appreciate those comments. And yeah, price is certainly an important consideration. And a lot of the data that's really interesting to me around, where we're looking for complementary versus substitution-like effects comes from data on the impacts of sales taxes and pricing of one product versus another. So I do want to just elevate that comment. I think that's, I really like that. I guess the other thing I would say, and I was aware of this as I was putting this talk together, there are other approaches to classifying and or typing dual users. And I did not reference those here. Megan Piper's work, she's done that, and so has Tom Brandon's group. And the focus is typically, looking at the amount of use and using that to classify dual users. So like heavy e-cigarette, but low combusted, vice versa, all the various combinations. I think that's incredibly useful too. What I wasn't able to find, which I made a mental note to talk to Lauren about, is, how do we bring together, and I think we're doing some of this and looking at reasons, our LCA approach and finding these classes. What is the relationship between amount of use as a way of classifying dual users? How does that relate to reasons for use? And I don't know that please someone alert me if someone's already done that and is looking at it in that way. But I think there's room to classify dual users in both of those ways, and we're going to find out that they're interrelated.
Mm-hmm. Um, Joe, this lecture reminds me of a paper that well, was actually a letter to psychopharmacology that John Hughes, Warren Bickel, and I wrote back in 1988. The properties of drugs, and the point that the letter made was that it was regarding like reinforcing properties or discriminative properties of a particular psychoactive drug. And the argument we were making is that these aren't properties that are inherent of the drug, they're functional
Mm.
relationships, and they're going to depend on the environmental conditions. And you are, I think, making that same point about these behavioral economic relationships, that they're functional relationships, and maybe dominant relationship like uh, substitution may characterize at a population level, but there are going to be individual differences, and
Yes.
those can be important. I think you're pointing out how they could be clinically important. So what I'm taking away from it is that these are functional relationships and they depend on a lot of often environmental conditions, but also interpersonal conditions, probably genetics, other things. So I
Yes.
wonder your thoughts on that.
I mean, 100%, Steve. And the other work that I do is, a lot of my work has been really focused on understanding how contexts drive um, uh, drug use, and understanding the relationship between contexts and consumption. And you're 100% right. And not only, yeah, there's individual differences in the way these things are structured, but I think the other piece that's really interesting here is that it's not only dynamic with respect to context, but also dynamic with respect to the sort of life course of product use for an individual.
Absolutely.
Um, and there are probably some developmental trajectories here as well. Yeah,
Yeah, like lung cancer screening. I would guess the function of cigarettes could change, be very different pre and post your
right.
screening at the individual level. So all good points.
Yeah.
I really appreciate the things you're pointing.
Yeah, I think the challenge and the place where I wanted to push myself a little bit in this talk, and I would challenge all of us, is to keep asking that question, does it matter? Like how do we if we think that it's more complex, and that it's time varying and context driven and there are individual differences, how do we leverage that information to be better at intervening?
Yeah. Let me read a couple of more questions. So one is a three-part question.
Mm.
First, research is clear dual use of cigarettes and e-cigarettes increase health compromises. Have you given up on trying to eliminate these products and just accept the status quo? Second, how do you protect children? Third, you don't address the costs in lives and healthcare costs. Why? Mm, pretty.
Yeah. Oh, I mean, those are all great questions, and if you give me another hour, we can tackle them. I think I think my nuanced view is maybe uh, I want to let's see. I want to be really careful the way I talk about this. I think in my nuanced view, e-cigarettes are not the complete and total 100% panacea that harm reduction folks might see them as. Because even if someone becomes a dual user, say in the context of a sampling study or a switching study or an intervention designed to um, transition them over to using e-cigarettes, if they become a dual user and their e-cigarette use replaces some of their nicotine consumption from combusted cigarettes, and we see a decrease in toxicant exposure, that's a net, that's good. But if we've made someone who is using these products as complements, and it means that it perpetuates their use of combusted cigarettes and delays cessation further, then over time they may end up with more exposure to carcinogens and toxicants than if they had quit smoking altogether. So I think it becomes very complicated, and I don't know that we've really started to model out these effects because we don't know what percentage of people, if we increase taxes on, if we created the right sort of regulatory environment where we saw an increase in the number of dual users, we don't know what percentage of them are going to be complementers versus substitutors, and we don't know what that means for long-term tobacco product use. So I'm not sure I can 100% address the question, but I don't know that I'm advocating for the status quo. I think we need to take a good hard look at what it means to create so many dual users through our interventions. In terms of kids, I don't think there's any acceptable reason for kids to use e-cigarettes. And I think we have examples of other consumer products where they're available to adults who use them, but their use among children is limited. But I think it requires a very careful balance, and definitely the topic for a future talk. I don't know, was there a third point I missed?
Oh,
I want to make sure that everyone is unhappy with me. So maybe there's a third one there, so we can just get all of it.
We're out of time, but we have a very patient audience, 45 people. The vast majority still with. So maybe I'll ask one more.
Okay.
To be courteous to the people who took the time to send us the questions. So this is one very thoughtful and interesting presentation. This question is a bit beyond what you've discussed, but it's clearly important to understanding the implications of complementarity. Have you examined whether those who use e-cigarettes with complementarity in mind are more or less likely to sustain their smoking over time, as in years, than people who smoke or do not use e-cigarettes?
I mean, that's a great question. And it's the question I just asked, and we don't know. And I would love, I would love even longer term follow-ups on some of these switching studies to see what happens to folks who are using them as complements in the long term. The other thing that Lauren and I are going to be doing is looking at trajectories of product use among complementers versus substitutors and path based on that class analysis. So we can definitely answer the question that way too. But I think that is the next most important question.
Yeah, excellent.
So thank you
very much, Joe. It's just really a stimulating and timely presentation. So thanks.
Awesome. Yeah, and people thank you, audience, and please be in touch with questions directly. I'd love to engage on this.
Great. All right. Well, thanks everybody, and please join us on December 18th if you can. This wraps up today's lecture. Thank you very much.